Namaskara. Welcome to NU Hospital's YouTube channel. In this podcast, let's talk about the silent struggle. Parenthood is a dream of many, but many couples struggle in silence. Every month they wait, every test brings a hope, but when the test fails, their hope and their heart breaks. And again, they'll start to suffer in silence. So today, let's break the myth, the silence, the struggle, and the stigma of infertility. So in this podcast, to have a conversation, we have Dr. Pramod Krishnappa, Senior Consultant, Andrologist and Urologist with 15 years of experience, and Dr. Sneha, Gynaecologist and IVF Specialist with 15 plus years of experience. Welcome to the show, Doctor. So according to World Health Organization, 1 out of 6 couples are suffering from infertility. So what exactly is infertility and what is the main reason for that?
See, the infertility definition says that somebody is unable to conceive and have been trying for 1 year and have been doing unprotected intercourse. So that's the definition of infertility, but that 1 year criteria is not very specific. It depends on the age. We do advise early consultations and not let patients wait till 1 year. So there are different causes. So me being an andrologist, so if you see what are the various causes of male infertility, to keep it simple, I can differentiate into 4 categories. So one would be sperm production issues. Second would be sperm transport issues. Third would be sexual health issues, which is very common and very most neglected. And third would be lifestyle issues.
Coming to the female factors, around female factors contribute about 50% of the overall infertility related problems. So in female infertility per se, so we can divide the causes relating to the factors coming from the ovary, the factors coming from the uterus, the factors coming from the fallopian tubes, and some are related to lifestyle and some are unexplained. So when we are coming to the ovary part, there could be decreased ovarian reserve, there could be polycystic ovaries, or there could be endometriotic cyst, or there could be congenital absence of one ovary, or there are some other cancer elements arising from the ovary which can decrease the ovarian reserve. So when we are talking about the uterus, there could be any congenital absence of the uterus, or there could be by birth only there is some problem in the genetically normal development of the ovaries, or there could be some septum, or there could be polyps, fibroids, or there are some changes in the endometrium which can damage the endometrium permanently. So all these are related to the uterine causes. So coming to the fallopian tube, which accounts for about 20% of the reasons. So there can be some infection of the fallopian tubes, either bacterial or so many other reasons are there. So tuberculosis being one of the most common cause in India, so which affects the fallopian tubes, which blocks the fallopian tubes basically. So a couple cannot conceive normally. So that constitutes around 20%. And other reasons being lifestyle factors, stress, and then 10% of the causes, even all the tests being normal, no reason is found out. So that is called as unexplained infertility.
Yeah, so like how Dr. Sneha told in detail about the various causes, so I told about the 4 categories. So the first, the sperm production issues could be due to so many reasons. Again, could be due to hormonal issues. The most important is the testosterone hormone could be very less. And it could be a genetic problem itself, like there are a few disorders like Klinefelter syndromes and so on, where the production of sperm itself doesn't happen. And normally the testis has, broadly, there are so many cells, but mainly there are 2 cells. So one is the germ cell which produces the sperm. The second is the Sertoli cell which produces the nutrition. So in some men, they just have only the Sertoli cell and they do not have the germ cells to produce the sperms. So that's one of the major issues. And the second, sperm transport issues. The obstructive cause is not as common in men when compared to the females. So obstructive causes, yes, tuberculosis is not that common in the male reproductive tract, but sometimes again genetic causes like congenital absence of vas deferens, like how Dr. Sneha spoke about the absence of fallopian tube and so on. Same thing can happen in the male reproductive tract as well. And sexual health, again, very much neglected. One of the major causes, I would say, for infertility nowadays, and which is very commonly missed in the infertility evaluation. So there's something called unconsummated marriage, which means the couple have been married since many years, but they have not been able to have a penetrative sex. They would have made attempts in the beginning, but then they attempt for 2-3 months, and then things are not happening, not going fine, and they just give up. And then maybe 1 or 2 years later, when there's a pressure from the parents or the friends saying that why haven't you tried yet to conceive, that is when then they come and consult us for infertility. But when we ask in detail about the sexual history, they say we haven't even had a penetrative sex. So that's something which quite common nowadays. And lifestyle changes, as Dr. Sneha said, the alcohol, smoking. I mean, it's not that nobody should do all this, but there should be some moderation for all this. And also the sleep hours. So all this does make a lot of impact on the male infertility.
Okay, so actually, to be very frank, that always when it comes for infertility, women are getting blamed more than comparatively for men. So actually, I have a friend who has married like almost for 5 years right now, and like whenever it comes for not having a baby, around her family or her close circle, everybody question her, ask her, and blame her why you are not having a baby. Why is that always women, and why men are not that much compared to women? They are not considered in infertility thing.
So we, for a long time, we have been a male-dominated society. So till now, what is assumed is infertility is always a woman's problem. So because of the ego issues, so men usually don't come up with their sexual problems, or maybe they could be having so many other issues, but they don't openly speak about it. But nowadays we are seeing a little change in the trend. Nowadays, because of the awareness and because of the lot of other information and materials available, now couple are coming with their problems openly to female specialists and male specialists as well. So as I told you before, only female factors like women's problems contribute around 50%, and male problems, they contribute about 30 to 40%. Okay, which is not largely taken into consideration. Okay, and 20% of the cases, it is almost like combined factors. Both male and female do have together problems, and another 10% is undiagnosed or uncategorized causes. So infertility means it is not always evaluating woman first and then bring the partner and then evaluating him second thing. So it is always both have to be evaluated, both their problems are to be assessed, and both have to be counseled, and treatment should be planned such a way that both their problems are addressed. So they are assessed as one single group. Then only the treatment can be effective.
Yeah, so that's very rightly said, that simultaneous evaluation of both husband and wife has to be done. Only then we'll pick up things early, and so that both can be optimized to get a good outcome with the infertility treatment. And I would request that men should get a semen analysis first. That's the most basic thing, which will give us a lot of information. And yes, after we see the semen analysis, then subsequently we can go for the other test like the hormone profile. So semen test is a must, which should be done.
Yes, doctor. Actually, in the previous conversation, you were telling that about lifestyle. So, in this generation, lifestyle plays a major role because people are not more into physical activities, and also like they are more into fancy food. They are not having the proper food and mobile usage, a laptop system. These are the major factors that this generation is running around. So, do these factors affect infertility?
See, lifestyle has been affecting the female fertility and male fertility. So in a very large way, actually. So the thing is, long hours of working and no time for themselves, to relax or for the stress reduction, no exercise, and then ready to eat foods are available everywhere. And definitely the environmental pollutants and toxins cannot be neglected, which is there everywhere. So, what is going into our body, like heavy metals and all, they can permanently damage the ovarian reserve as well as the sperm quality and quantity. So definitely these needs to be addressed, and there is rise in the obesity, both the male and the female obesity. So this obesity also directly affects the ovarian reserve, quality of the eggs and quality of the sperms as well. So definitely, and there is increase in the habits like smoking, drinks, drugs, and use of gym supplements. All these are on rise. Definitely they do affect the fertility much earlier than we think. And there is also shift in the menstrual pattern. Nowadays, children are hitting puberty very early. Even boys are hitting puberty very early as 8 years. So the menstrual window has shifted. So early puberty and early menopause, these are the now happening trend. So definitely lifestyle parameters have to be addressed as quickly as possible. And there is also increase in the metabolic problems and lifestyle diseases. So how they affect means these subtle signs. Once the couple get married, the subtle signs are should not be neglected. There could be some anxiety issues, there could be weight gain, there could be hair fall or acne or menstrual irregularities like scanty flow or heavy flow, or long cycles or short cycles. Sometimes vaginal dryness may be there, or there may be decrease in the desire to have sex, that is called as libido. Even men presenting with erectile and ejaculatory dysfunction. So all these are subtle signs, but definitely they need some approach and some treatment, definitely.
Yeah, so you're talking about the mobile phones. That's a very hot topic discussion. So in fact, see, mobile phones are a part of our daily life. It's not easy that we cannot advise patients that, okay, don't use your mobile phones. Yes, they do emit radiation. For example, we usually say as an andrologist, we can say that patients that don't keep your phones in the pant pockets or the trouser pockets. And then if you go to a cardiologist, he will say that not to keep in the shirt pockets because it's closer to the heart. So then where do we men keep the mobile phones? So with the technology comes the ill effects of it. So there's no easy solutions to this. But to the extent possible, we need to try and avoid mobile phones. Maybe simple things like not to keep your mobile phones just beside your bed during sleep. So just keep it a little away. And wherever possible, not to keep too much time in your pockets. If you're sitting on a chair, you can just leave your phones on the table for some time. So these subtle things. And when it comes to lifestyle changes, we can always say quit smoking, quit alcohol, all that is easy to say, but we need to give a practical options to the patients. So what I usually recommend is, as a lifestyle change, everybody need not compulsorily join a gym. They can start with a simple jogging, maybe for 20 minutes. And they can do some push-ups, 10 push-ups. And if they have a dumbbell, they can just do some 10, 15 biceps curls. So that should be more than enough. They need not join a gym and then they get lost in that and they start taking all these powders in the gym. So just do basic exercise, a moderate exercise. Don't strain too much. And smoking, even in small quantities, does affect the sperm motility. So when a couple are trying to conceive, not happening, so we usually advise at least quit smoking for some time till all this is sorted out. Alcohol, occasional social drinking is still fine, but smoking needs to be stopped when they're trying to conceive. This is something we advise.